I've seen patients who continue to struggle with persistent weight gain despite trying to count calories, exercise, or take different medications. In this short video, I'm going to go over a few of the hormonal imbalances that can lead to weight gain, that can lead to metabolic dysfunction, or persistent weight gain. So let's dive into it. So I'm going to use this whiteboard to show the several pathways that we're looking into in the functional weight loss approach. And so the first one that I'm going to talk about briefly is the gut bacteria. In our gut, we have a whole ecosystem, and I'm going to draw here the gut bacteria. And those gut bacteria ferment fiber to create short-chain fatty acid, different metabolites such as butyrate or propionate. Now, one of the issues that we're seeing with patients is a state of dysbiosis, which means in other words, an imbalanced gut bacteria. What an imbalanced gut bacteria, or otherwise referred to as dysbiosis, can do, it could lead to a reduction in the amount of short-chain fatty acids. Short-chain fatty acids are really important for our metabolism. You also have reduction in the secretion of an hormone that is called GLP-1 from the enteroendocrine L cells in our gut. And eventually, this leads a reduction in GLP-1 secretion, can lead to increased hunger, and it can also alter our glycemic response because GLP-1 has an effect, specific effect on the pancreas, which essentially over time can lead to persistent weight gain. Now, we have seen patients who skip this whole metabolic pathway and try to go straight for the GLP-1 medication. The problem with that is that if we have not figured out the root cause, the underlying cause, which could be dysbiosis or certain foods that they're eating or inflammatory environment in the gut that leads to the reduction in GLP-1, and they're taking medication, one, they're going to be having to be dependent on this medication, which is fairly expensive medication, for the rest of their lives. Additionally, there are some concerns that are rising in research studies that are showing concern for long-term use of GLP-1 and thyroid carcinoma and loss of muscle and bone mass. And so the better you understand these pathways, more you can provide a long-term results, better results for your clients. Let's take a look at another interesting pathway that is often overlooked by many practitioners in the standard of care, and that's our thyroid hormones. So our thyroid hormones obviously secrete, I'm going to draw the thyroid. So our thyroid hormones obviously secrete T4, and that is being converted, some T3, and majority of it is being converted into T3 in the peripheral tissues. But there's another hormone that is competitive, and that is reverse T3. So if you have conversion, if you have higher amounts of reverse T3, or you don't have enough conversion from T4 to T3, that's one issue. If you have conversion of T4 to reverse T3, that's another issue. Because what essentially will happen here, let's say this is our cellular receptors, right? This is our receptor. And T3 is supposed to be plugging in here and stimulate our mitochondria to produce ATP, to oxidize fat. And reverse T3 essentially can come in here and plug in here and block T3 from activating those receptors, the nuclear receptor on top of our cells. And so what that would essentially do is lead to a reduction in our basal metabolic rate, which over time contributes to weight gain. One of the issues we're seeing, for example, with prescription of thyroid medication is that they only address one part of the whole picture. You essentially prescribe the patient with T4. But if you don't address the conversion to T3, or you don't address other factors like the conversion of T4 to reverse T3 that is metabolically inactive or a competitive inhibitor of T3 at the thyroid hormone receptor level, which is here, if you don't address this issue, you will still have patients coming back saying, still feeling tired, I'm constipated, I still struggle with weight gain, my hair falls out, all these symptoms or signs of imbalanced thyroid hormones. Now, since we are talking about weight gain and hormones, let's go back to talking about another common issue that we're seeing with practitioners, and that is testosterone. Testosterone, and I'll give this as another example. There's multiple different pathways. We can talk about estrogen, we can talk about cortisol, but let's talk about testosterone for a second, because testosterone is so important for fat oxidation, for maintaining lean muscle mass, which supports our basal metabolic rate. When I talk about testosterone, there's a couple of different issues that we often see. One is the issue of elevated cortisol. And so every time we are stressed, our body secretes cortisol. Now, elevated cortisol essentially interfere with the signaling in the hypothalamic pituitary gonadal axis. So we'll just put it here. This is the hypothalamic pituitary gonadal axis, which leads to a reduction in luteinizing hormone, which is LH. We'll just type in LH. And that leads to reduction in the production of testosterone. So now you have reduction in production of testosterone. And one of the problems we're seeing is there's lots of patients who are going to a practitioner, they check their hormones and they say, well, weight gain, if they do check it, weight gain is related to lower testosterone. Okay, they give them testosterone, right? But if you give a patient testosterone, right, but you have not addressed these issues, right? You didn't address the cortisol, the hypothalamic pituitary gonadal signaling axis. If you didn't address the issue of the HPA axis, which leads to the secretion of cortisol because of stress, if you did not address those underlying issues, your patients could develop other conditions. For example, cortisol by itself, elevated cortisol by itself, leads to gluconeogenesis in the liver, which contributes to weight gain. And then, of course, we have chronic inflammation. So inflammation, if your patient have chronic inflammations, many patients, if they have a chronic condition, it is very likely that there's inflammation that is involved in it. Inflammation is one of our biggest challenges with chronic patients. If they got chronic inflammations, they got also inflammatory cytokines like interleukin 6 or tumor necrosis factor alpha. It also impairs the function of the aromatase activity. So I'm going to put this aromatase activity, which essentially converts testosterone into estradiol. So if you have an increase in aromatase activity, you now have increased conversion of testosterone to estradiol, and then your bioavailable testosterone, again, the amount of bioavailable testosterone reduces, which again contributes to weight gain. And this is, I draw this as several examples for how it's so important to have a comprehensive understanding of what's going on physiologically with our patients, because we're seeing so many patients that continue to struggle. Statistically, there's one survey that showed that about 70% of chronic patients are dissatisfied with the standard of care. And many of those patients are looking for other solutions. And so all of this led to a new approach that is called or referred to as functional weight loss. And functional weight loss, we look at different strategies to support weight loss by using dietary patterns, lifestyle recommendations, and also specific nutraceuticals, either botanical or nutritional supplements. But most importantly, we learn in depth all the different hormonal pathways, the gut, we go into environmental factors, we go into all the different pathways. And so the better you understand this, the better results and clinical outcome you can get your patients without putting them on a drug that they'll be dependent on for the rest of their lives, or if they stop, they get a terrible rebound. We've seen practitioners that utilize this approach together with the GLP-1 agonist or weight loss medications to get a better clinical outcome or a better long-term outcome. And we've seen practitioners that just focus on this and help their patients, support their patients in their journey to lose weight by focusing on the underlying cause and helping their patients to address it. Now, there's a lot more that we can talk about these different pathways. We have, if you're interested in learning more about those pathways and the clinical application and what are the specific lab testing, like how do we test for all of these different, how do we test for short-chain fatty acid, right? How do we test for dysbiosis? How do we test the thyroid hormones, and what do we do about it when things are out of balance? How do we test cortisol, or how do we test the HPA axis function or dysfunction? How do we test for inflammatory markers? How do we test for the cellular activity? We dive into all of those different labs and pathways and treatment protocols that you can use in your practice in our program, the Functional Weight Loss Certification. So if you're interested in learning more, click on the link and we'll be happy to see you there. You can learn more about it and join our program. Thank you so much for watching. I hope that this was beneficial to help your patients in getting better clinical results. Thanks for watching. I'll see you in the next class.